Want to find out about a new device to treat snoring and sleep apnea? Watch this video. So hi everyone, my name is Lau Hung Tuan. I'm an ear, nose, throat specialist in private practice in Singapore. So a hypoglossal nerve stimulation implant is a surgically implanted medical device that works for the treatment of obstructive sleep apnea. A hypoglossal nerve is a nerve in our upper neck that supplies movement of our tongue. In patients with obstructive sleep apnea, their upper airways collapse during sleep, and that leads to oxygen desaturations and also frequent awakenings during their sleep. So with a hypoglossal nerve stimulation implant, a device is implanted in our chest and our neck that allows for the tongue to gently be protruded forward using gentle pulses. This in turn helps the tongue, which collapses in obstructive sleep apnea, to move forward and open up and stabilize our upper airway, thereby treating obstructive sleep apnea. So while not all obstructive sleep apnea patients may benefit from hypoglossal nerve stimulation therapy, a good number of them may benefit from them. Patients that will benefit from this therapy will be those with what we call moderate or severe obstructive sleep apnea. In medical terms, that is a apnea-hypopnea index, or in layman terms, that is a choking index count of more than 15 counts per hour. Patients who have tried or are unable to tolerate other forms of sleep apnea treatment, such as continuous positive airway pressure or CPAP therapy, dental device therapy, or who have tried other forms of sleep apnea surgery and did not get an optimal outcome, would be patients that would benefit from hypoglossal nerve stimulation therapy. Of course, having seen a sleep doctor who offers this therapy, then the sleep doctor will have to do other checks. For example, looking at some of the finer print readings in your sleep test, checking your body mass index, and also doing an airway check to make sure you are a suitable candidate for this therapy. So there are three main benefits of this treatment over other traditional options. The first is that this option is entirely within your system. The hypoglossal nerve implant and the connections are entirely within your body. So unlike using CPAP, where you have to use a mask and a hose that's connected externally, this device is entirely within your body. The second is that it treats one of the main root causes of sleep apnea, which is the tongue collapsing backwards during sleep. So in doing so, you are really addressing the root cause of sleep apnea. The third is that unlike other forms of sleep apnea surgery, where there are invasive incisions made in the throat, hypoglossal nerve stimulation implantation is external to the throat. So it is not as painful, and also you do not run the potential risk of having airway bleeding or airway swelling, which can sometimes be very serious and life-threatening. This is where the results are very promising. If we look at long-term studies across the world on hypoglossal nerve stimulation implant, we see that there's a 79% reduction in sleep apnea count. Also, we find that 90% of patients or bed partners notice that they have no or mild snoring. In terms of patient satisfaction, then we find that there is a 91% satisfaction rate amongst patients, and about 94 to 96% of patients would recommend this therapy over CPAP and to their relatives. After one has been implanted with the device in their neck and their chest, the wounds are allowed to heal for a month. At a month after surgery, then the doctor will check the wound and also switch on the implant and test the implant to look for whether it is working and whether it is comfortable within the chest and the neck. Subsequently, the patient may then turn on the implant, and some patients may find benefit. But at 3 months, the patients will come back to our sleep lab for us to be able to fine-tune the implant and see how we can achieve the best results for that patient for their sleep apnea. So there are two parts to the maintenance and the follow-up. In terms of the maintenance, then there's actually very little maintenance in terms of hypoglossal nerve implant. The implant sits within the neck and the chest, and there's no need for any daily care. The patient simply using a wireless remote turns on the device before they sleep and turn on the device when they wake up. In terms of follow-up, then as mentioned before, the patients will need their stitches removed at a week after surgery. they will need the machine turned on, the device turned on at a month, and a sleep study to fine-tune the results at about 3 months after surgery. And that's basically the care that's needed for this treatment. So there is no lifestyle change needed at all for this procedure. Virtually all patients lead a very normal life after they've had this surgery. The only precaution I would take is for patients who may be doing contact sports with high direct impact to the neck or the chest, to avoid that, and to consider whether or not they are suitable if they wish to continue doing so after having the implantation.